Hi. Thank you for presenting for us today, Anne-Marie.
Thanks, Courtney. Good morning to everyone. As Courtney said, this is the first in a series of webinars. As such, we're just sort of mucking a little bit through the technology, so forgive us if we have some problems today. We're working on that. You might have noticed along with the webinar that there are a series of attachments to the webinar that you can download and print off. And those are some tools and aids that we will be going over through the course of the webinar today, so you might want to take a moment and download those. We've also planned for a little bit of question and answer session at the end of the webinar. We will open up the lines for you to be able to either come in and voice those questions, or you can use the question text box and send those to us, and we'll try to fit those in at the end. So let's get started. Did you move to the next slide? Okay, so we have the idea in the field of evaluation, it's sort of the notion of why is evaluation so difficult. And I think that it's one of those things that if we can sort of frame in our mind the challenges that evaluation place before us as we think about writing an RFP, that in the end that we can actually overcome many of the challenges. So as a field, public health has in the past 100 years really expanded. We've moved beyond that realm of dealing mostly in infectious disease into much more focus on chronic disease and broadening our scope into things such as violence and emerging pathogens and bioterrorism. All of these kinds of topics have a tremendous social context to them. And as such, that means that our evaluation has become much more complex. The idea that we develop an immunization and we can apply that, disperse that, disseminate that out to the population and have a huge impact with that single intervention is not the case when we're dealing with things like chronic disease, which are multifactorial and require multiple sectors to work on the problem at any one time if we're going to make a change. So there's been the added notion of complexity to the things that we do. To that complexity, we've also added really an emergence of definitions of what evaluation is. And along with that, a proliferation in the types of methodologies that we use in evaluation. It's long gone are the days that we only think about surveys as the only method for doing evaluation. We now have things such as document reviews and observation, participatory observation. Our definitions have expanded beyond summative and formative to include things such as developmental evaluation. In the end, we also are confronted with methodological questions as simple as, what scale do I use? Do I use a 5-point Likert scale or a 7? So all the complexities that have come to have an effect on the work that we do sort of leads to a case of where complexity is being met with complexity. And for one to really grasp that statement, I think one has to forget that evaluation it's not a thing. It's not a survey. It's not a focus group. It's not a report that we write, but rather really evaluation in terms of writing our RFPs is a series of choices. The tools that we provide today are a starting point to thoughtfully manage your way through those choices that confront you as you write your RFP. And there's always the second part to why evaluation is difficult. It's not enough that we have part one, but we have part two, and that is that evaluation, as we all know, is generally an uncomfortable space to be in. We are, in effect, making a judgment. We hope that that is a data-based, information-based judgment, but invariably those kinds of judgments lead to the opportunity for one group to be empowered over another, or the opportunity for the results that we identify as having negative consequences for a program, or even that the results that we have reinforce the status quo. The only time that we can really make the case for when evaluation is not necessary, is really if we want to stand back and say, nobody cares about the program, no one has any monies invested in it, and no one really particularly participates in that. And hopefully that's not the kind of program that we're writing. We're trying to write our RFP too. In terms of the group that's on the webinar today, it's comprised of some community-based organizations, local health departments, directors, and project managers. As such, we have a pretty vast, varied group of expertise around evaluation. And the idea of today's evaluation is to provide you, as managers overseeing programs, with a framework to think about stepping into the evaluation process. Whether you are the one who's actually going to follow through and do the evaluation, or whether you'll be hiring out to an external entity to do the evaluation for you. Having some frameworks to guide those discussions and guide the development of your RFP is just good groundwork to have underneath you as you start the process. Okay, so the image that's up on the screen now is a model that the CDC developed in 1997. They recognized at that time, as really the whole accountability era was segueing in, that much of the evaluation done in public health work was not very good. And as such, our programs were not getting the credit that they deserved. And so the CDC worked very hard in developing a framework in lots of educational sessions to help people that worked in the field of public health step up the ante with their evaluation. So on the outside of that diagram that you're looking at are the actual steps of evaluation. And according to the CDC, you would start with the engaged stakeholders and follow the circle around through the 6 steps and end with ensure use and share lessons learned. Today's webinar is really going to focus on the program description element, step number 2. But what I would like to draw your attention to is the center of that model that the CDC has, which identifies standards. And this is the first framework as a program manager that I would really suggest is a framework that you would want to have closely in mind as you're developing your RFP or as you're engaging in the conversations with an evaluation professional about helping you see the program through in terms of evaluation. So these 4 standards, utility, feasibility, propriety, and accuracy, are ways for you to think about critiquing an evaluation process. So we use these 4 standards to identify whether the evaluation process that we are incorporating into our RFP and eventually our program is living up to the standards that are put out there for evaluation. So the first of those is utility, and that is, did the evaluation serve the information needs of its intended users? it used to be that we would think about evaluation serving basically one need, and that was that of the funder. But nowadays that we understand that evaluation often times serves multiple stakeholders that we have to keep happy and informed respective of our programs. So from the get-go, we really need to have an understanding of key stakeholders and what the kinds of information those stakeholders need to really put a finger on whether they feel the program that you're running is meeting their needs. And those information needs vary greatly. How the funder understands a program versus how a participant understands a program versus how the organization who is implementing the program. Those are all varied perspectives. So really understanding who you're going to owe information to in the end and how they're going to use that information is tremendously helpful. Feasibility. Evaluation, as the invitation to this webinar suggested, is generally quite costly. So we have to think about what resources we have and how feasible it is that we actually launch the evaluation process. We have to think about feasibility of the kinds of information we're going to try to gather. If we're trying to gather information about our participants and we're thinking that we're going to do it in a survey monkey format, but we know that a large swath of our participants don't have internet access or regular internet access, that's not a feasible approach to take. So thinking through feasibility of our evaluation is really important. Propriety has to do with the legal, ethical parameters of your evaluation. That there are no conflicts of interest or minimized conflicts of interest is something you should always be able to speak to. And then, of course, we want to look towards accuracy, that both in our technical, in our data, in how we write our reports, that we are presenting our information in accurate and also just accurately framed dialogue. So those are standards that I think are particularly, if we're going to hire to an outside evaluator, are some things that you would want to be discussing with your evaluator. So as I said, today's webinar is really focused on program description. And my whole, the objectives of the program are first to convince you that program description is really the single most important task in the evaluation process, not only to the management of the program, but to its evaluation as well. It really is the starting point, and it's a point that you're going to come back to. We think about writing a program description, and it sort of sits there statically. In fact, we can't, that isn't the truth of how programs run. We all know that how we plan for a program and how it gets implemented and flushed through oftentimes changes because of the context change. The other objective of the program is to provide you with some tools that can really improve your efforts around this idea of program description. I think it's always really useful to start with an analogy when we're moving into sort of trying to understand any big topic area. And the analogy I use today is, you know, if we think about a physician and as patients arrive at his practice, physicians are inundated with so much information, not only the information that comes from the individual that they're assessing, but the information that they have from their knowledge and their professional background, the information that is in the medical chart. And as this little character shows, the endless information, you know, that oftentimes the patient wants to spill out. And somehow through all of that information in a relatively defined amount of time, a physician has to identify what are the important elements of this story and create a plan for addressing those and write a prescription. And that's much like how we, I think, feel when we start to write an RFP. There's a tremendous amount of information out there, and there's a lot of ideas on how a program, what we do in our workplace, and what our organization stands for. There's a framework that the RFP will ask us to write in, but that framework oftentimes doesn't do justice to the moderate ways that we might want to write. I also think about this in terms of just how we feel as working in the information age. You know, there's so much data out there. How do we begin to prioritize what that information is so that we can use it in the most meaningful way? In the world of healthcare, physicians are increasingly using what are called decision support systems. And decision support systems are information and communication technologies which take information from multiple areas and move that through a heuristic formula in order to help physicians come up with better plans. So it would integrate information from a health information exchange system and an electronic record, along with the information the physician is entering as the patient here tells him, and come up with some suggested things that the physician might consider as a diagnosis for whatever is ailing this particular patient. It's really interesting to think about how those systems get built, and that's basically by another individual working with physicians around what one calls tacit knowledge. What we've come to understand is that professionals such as physicians operate on a sort of unseen level, making lots and lots of decisions around information that comes in based on sort of all this previous knowledge they have. So as the patient tells the physician his various ailments here, there's a little mini computer going on in that physician's head that sort of subliminally helps him rule out certain diagnoses, question some so he comes back with more questions to ask that patient so he can continue to rule out. This is much of the same process that we have to take as we write an RFP. We have to rule out those kinds of bits of information that aren't priority, that aren't going to make the best case for us. And we have to identify the bits of information and string those together in a story. So in the end, our RFP has a solid story to a coherent story, one that really makes sense to the reader. The tools that we're going to use today are in an effort to help you sort of bring up that tacit knowledge that you often work with and help you create that more fluid RFP. So the next slide here is going back to the CDC's framework, and it's the components that they suggest make up the program description element of the evaluation process. And according to the CDC, and I think you'll recognize these elements as common to any RFP that you would be writing about. So we identify a need, we identify expected effects, activities, resources, stage, and context. What we generally do very well on is writing about need. We generally, as we create our RFP, are very clear on sort of the health indicators, the population health indicators, the socioeconomic types of indicators that really sort of set the parameters around the problem that we're addressing. Where we tend to not do quite as well on our RFP writing is really about stage and context. And much of what I'm going to focus on today is to actually try to help flip our thinking to focus on stage and context and how that really can open a sort of new paradigm for us to think about as we write RFPs. The shift here that I really would want to emphasize is a move to really focusing on stage and context, as I said, and it's a slightly different step into what I think historically most of us have been trained on, which is the logic model. If we take a look at the next slide, I think this is a slide that if you work in public health, you're very familiar with. If you've done evaluation work, this is what you have most likely been trained on. And while the elements on the upper half of the slide, such as the vision and mission and goals, all normally sit on a logic model, for most of us, we've been given the worksheet and it's inputs, activities, outputs, and outcomes. When we use a logic model like this, we have a couple things that it sort of drives. First of all, there's a real focus on the inputs. A logic model basically comes out of a framework of looking at a program through the resources that any particular agency or the department that's managing the particular program has at its disposal. And that would be a little bit equivalent to sort of going back to the notion of that physician working with his patient in the office, and the physician, coming up with a plan, but doing that completely through a framework of what resources he has available to him in his office. And I think we can begin to understand that we would hope a physician makes his plan based on a greater scope than just the resources that he has available to him in his office. The logic model is a very useful tool when we think about program management, but it's not particularly a useful tool when we're in the program planning stage, which is really what the RFP is all about. I want to jump back for 1 second to the slide before and show the components of the program description again. And the other point I wanted to make about this, and I think this is something that's very true of how RFPs are designed because they come to us as a flat desktop Word document that we're generally filling out, is that oftentimes because of how that's laid out and very much how the diagram you're looking at right now shows, it sort of puts these things in lists and makes it so that they are disconnected, that we actually move through this list and complete each one of these, discreetly. And again, I think all of us as program managers come to find out that, none of these are disconnected in themselves, individual elements. The needs that we identify are closely related to the resources we have, as well as the expected effects that we have. Time and time again, I think I come back to the notion that as we develop our RFP, it really is a set of choices that we're going to go through. And as we think about those choices, it's aligning the choices so that in the end, it's a story that has coherence to it. So the idea that these are disconnected sort of elements that we fill out on an RFP is not the truth, as we know in implementing our programs. Okay. So the first thing I want to bring up is one of the sidebars, which is the tool called the program checklist. So this is the first tool that I would share with you when you're thinking about writing your RFP. And what this program description checklist does is provide you really with an organizer. If you think about writing your RFP, it's a way to think about what are the things as I begin to write my RFP that I need to organize, that I need to pull together and have spent some time with in order to really do a great job of writing my RFP. I'm not going to spend a lot of time on this today other than to say it is sort of a yes, not yet, haven't quite completed. It's quite comprehensive. It goes from everything to your program model, whether you've done a lit review to understand the program that you're implementing, those kinds of things. So this is the type of thing that as you start thinking about that RFP, which we hope that you're not thinking about that the week that it's due, the kinds of tools that I'm going to show you today take some planning. I would give myself at least a month's time to write an RFP. So this is the beginning checklist. This is the first thing I would send you to go over to start to think about the elements that you have to bring together. It's also a great place to document sources that you're going to be citing in your RFP. Frequently through an RFP, we're citing other literature sources that support the model, the program that we're going to implement, and this is a good place to start citing those sources so you have that at hand when you write the RFP. All of the attachments that we have on today's webinar are in a Word format, and we intentionally did not move them into a PDF in order that you can sort of modify these documents as you choose. So please take them and do modifications as you see needed for your program and your RFP. So at the heart of today's webinar is really this program description tool that we have. So let's bring that up. Give us a minute here. Okay, so the tool that I'm providing today in the white section of that tool is the actual program description in sort of the brown colored element of the worksheet. Is it up yet?
It is up.
Great, thank you, Dylan. Is an example that we're going to use to go through today's program description. And that example program is the National Diabetes Prevention Program. Can we bring up the other PDF quickly? So the National Diabetes Prevention Program is a program, no, not that one, sorry. It's the other PDF. Is a program sponsored by the CDC. In 2002, a major research was completed around a program that really looked at lifestyle changes as a potential for having an impact on avoiding the progression to diabetes from pre-diabetes to diabetes, and it proved itself very effective. So CDC, along with its partners, wanted to take this program and really see how they could scale it up and move it out nationally. Go to the top part of that. Is that what we're looking at? Mm-hmm. Okay. So we have about 86 million adults in America. 9 out of 10 people who actually are pre-diabetic. That's an amazing number. So if there's a way that we could affect lowering the number of individuals who move from pre-diabetes to diabetes, that would be significant in our work. As part of developing this, they have developed a very comprehensive year-long program that participants and participating organizations offer individuals. It is a program that CDC very much would like to see multiple stakeholders in a community engaged in, and feeling that that's the best way to scale up and make sustainable the program. This is just a little informational sheet that CDC puts out about the program. We have in our both our DSRIP and FIP regions of AHI's province, we have several organizations who are implementing or in various stages of implementing this program. So I wanted to use something that for at least some of us on the webinar today would ring as a program, ring true as a program we're attempting to implement. So that will be for going through back to our program description sheet. That's the program that we'll be following through this. So on the first page of this description worksheet, we have the basic elements of any RFP, that you have to identify the problem, you have to identify what need there is in relation to that problem, and we have to identify the outcomes. And the challenge with the worksheet that I'm putting forward to you today is actually to keep your response to these items in these short little segments here. What I really am pushing you to do is to be very concise and clear on identifying these. And that's terrifically difficult. As I work with people writing RFPs, we tend to get very wordy and we want to put everything we can into supporting our RFP, when in fact, increasingly, organizations, funders who are vetting these really want you to be concise, and they want to be able to see very clearly how the problem or issue aligns with a need, you know, emanates out of a need and then aligns with an outcome, effect, or output. So the example here given is according to the CDC, there's 86 million Americans living with prediabetes, and nearly 90% of them are unaware of it. Data from my county hospitals show a high percentage, 43% of diabetes-related emergency room visits are first-time diabetes patients, or first-time diagnosis. A survey of county primary care providers indicates that less than 20% of providers have pre-diabetes screening protocol included in their practice routine. That's a great example of a really concise problem statement. And the problem statement really, I think oftentimes when we write our RFPs, we somewhat confuse the problem statement with the need. The problem is you really look at the one example used here, is the problems in the context where we are. We want to have that big global, so what the CDC, what those sort of national population numbers are, but we very quickly want to bring it down to where our service area, what's the problem there, and there's a couple of pieces of data, I think, in that problem statement that do a great job of that. Identifying organizations that might collect that kind of data for you so that you can, in fact, fold that into your RFP is a first step. Again, I think this is a great example of it. The need statement, I'm not going to spend a lot of time on because I think, in fact, this is the area that we do a great job on. We can turn to our county health indicators. We can turn to other Department of Health indicators. We have some of our own indicators, prevention agenda indicators, that we are, for the most part, fairly knowledgeable on identifying those and bringing those into a need statement. I think for our desired outcomes, again, it's important to think here, you know, we're trying to develop a concise set of statements here in order to sell our program, to make it look like we've really done our homework and we understand where we're going with this. So outcomes, generally are best at least first described in sort of higher category outcomes. So the outcome statement here: increase the number of primary care providers with diabetes screening protocol. Very much a process outcome, but aligns directly with our problem statement. Develop a referral system. So we understand that in order, not only do we have to get physicians on board for screening, but we have to develop a referral system for getting them into these programs, these diabetes prevention programs that exist in the community. Without those, our overall, our program is probably not going to fly the way we wanted it to. And finally, we do generally want an outcome or an impact statement as part of our outcomes. So we need to build our national diabetes prevention site capacity to meet the county need. And in the end, our goal is to lower incidence of type 2 adult diabetes in my county by 25% in 5 years. Those are things, you know, part of the time frame where you would like to see the impact affected goes back to a large extent on understanding how data is collected. So we really need to, as we try to identify those impact time frames, 5 years, we'd like to see a 25%. We need to keep in mind how data is collected respective of that indicator and whether a 5-year time frame really meets our bill. On the other hand, you know, I think one of the biggest arguments I hear nowadays is it really is difficult in the time frame of an RFP, which can it be generally anywhere from 2 years to 5. How do we show impact? And if it's the case that the types of measures that would show it that ultimately you hope to have an impact wouldn't be able to show an impact because they're not on a 5-year or a 2-year time frame, then you have to choose some in-between indicators as showing steps towards that ultimate impact. And that's why having these really concise 3 statements, problem, need, and desire, becomes so important in helping you frame moving along that choice path as to what indicators will ultimately make up your set of reporting tools. Okay. The next sort of frame of questions really moves into the contextual issues that I've been talking about. So oftentimes when we write an RFP, and because going back to how they frame it, we're writing based on an evaluation process that's going to meet the need of the funder, right? These are the funders that we're writing the RFP to, and the types of evaluation outcomes that they're going to be looking for very much come from the framework of the funder. That's a different perspective than you're writing the RFP in terms of what's going to make this program work in my setting. And these are opportunities, these next couple of sets of questions, to really work around the specifics of what's real in your workplace, what's real in the context of your community, what's real relative to the stakeholders that you have beyond the funder, and what's real in terms of your abilities as the unit that's managing the program. And some of the examples I provide here come from just my conversations with my friends up at CDPH and in Franklin County who are currently trying to get their National Diabetes Prevention Program up and running and moving it towards that recognized state, being able to operate so that they are a recognized CDC NDPP program. So in terms of an organization and where it's housed, you know, maybe there's some significant changes going on in your organization. maybe there are not. I think for most of us, given being in either public health or the healthcare genre in large, there's tremendous change going on that might affect any one of our programs. And being articulate about that helps us understand whether this, what are the additional things we're going to have to think about adding to our program beyond what the scope of any curriculum we're given or any set of evaluation measures we're going to be held to. How does the community affect the program? I think one of the biggest concerns or one of the biggest challenges for the NDPP program, as I've heard from, again, our partners up north, is that this is a program that meets over, its participants meet over a whole year's time. Even though when we sort of condense that down, it's really 24 hours, of a day in terms of number of hours. It's one day of your life. That's spread over a whole year. And the idea is that these individuals come to sometimes weekly and then monthly meetings. Transportation is a huge problem for us in the North Country and in the rural areas. So a major pillar to getting people interested in the NDPP program thus far, where people have tried to implement it, is actually having the transportation to get them to the meetings. They generally can get people interested based on information about it, but being able to get to the program regularly becomes a problem. So what's happening in your community that might support it? Or, so this example shows you a grassroots effort to bring Uber, which is a rideshare program, an increasingly common and really well accepted rideshare program, but in more urban places. Other opportunities people have talked about is moving it to an internet-based, like a webinar, like we're doing today, as a means for holding these meetings as opposed to coming together. So contextualizing it in terms of your community and what resources are out there. Oftentimes we might have to partner with a community college who has that kind of technology if our program, if our unit, our organization doesn't have access to that. I think the same kinds of things hold true for key stakeholders in units. I'm going to skip down next to our target population and things that we need to take into consideration there. Part of the NDPP program is that as it stands right now, a number of people, a huge percent of the American population receives its health care coverage through Medicaid, Medicare. So unfortunately, as it stands right now, neither of those programs cover reimbursement either around screening for prediabetes or the NDPP program itself. So we want to implement an evidence-great program like NDPP, but we can't do it without the recognition that many of our target population will have to pay for this out of pocket. Or, with that recognition, how can we work with some other stakeholders to gain some monies in order to create incentives to help pay for some of this? How might employers or other health insurers help foot this bill in the end, because it will save them money? We can't really get to that if we don't spend a good amount of time of understanding our target population and what the barriers to their participation in any program might be. All right, I want to skip ahead. The next two items on there talk about what other programs you might see your participants in that would either, add to the feasibility, the fidelity, the feasibility of your implementing a program, and what assumptions that you might have about the program and the process, the model that you're putting forward. I think assumptions, as the word just implies, are below the surface, and an important part and the point behind these whole tools is to pull those up and help us identify them. So I think a common assumption, or at least when I've talked to my partners who are implementing NDPP, is that, originally they had this assumption that primary practitioners would have really good buy-in. We can show them this infographic from the CDC, and 9 out of 10 adult Americans age 65 and older are qualify as pre-diabetic. That's fairly compelling, and you would think that primary care would be compelled by that. But when you put it in the framework of all the changes that are being sort of implemented through primary care, how do we get them to prioritize it? Is it a big assumption to think that they're going to grab this and want to run with it? Our partners have found that. So how do we incentivize? How do we help? How do we make it easier for primary care? These are the kinds of things that ultimately your program description needs to address. That the RFP itself, if we just follow the framework of the funder, is never going to identify and really will, in effect, limit the impact of your program. Okay, in an effort to sort of stay on track here, because we're getting, I can see time is getting a little bit short. What time do we have, Tom? Right. I'm gonna skip over the final sections of this worksheet because I think that they're self-explanatory. The examples given for the NDPP I think are really great examples of how to answer those questions. What I would go back to with respect to using this tool is the whole idea here is to get concise and short answers to this. And it's not a one-time go-through. This is a document that over the course of that month of writing your RFP and coming back, it's something you're going to, as you find out new things, as you really investigate your target population or you investigate the community and activities going on there. This is a document that gets tweaked, that gets shifted and moved. And even once your program gets up and moving, it's a document to come back to and update. I think it's a great, and again, we gave it to you in a Word document format so you can tweak and move and use it as works for you. Okay, the final sort of worksheet that I want to, or tool that I want to show you is the program model. Yeah, but is that?
The actual document?
Yeah.
Is that in PDF form?
It's in a Word document. It's called Model. Great. So, also, you know, eventually, there's a couple ways to use this program model. Basically, what it's taking is little excerpts from the program description that you created and putting it into a model for you. And the ways that I would recommend that you use this is first as an element to be able to share with some partners, with those people that, you know, you feel you want to have some input on your RFP, as a way to run by them. This is what I'm thinking. These are the key elements of, as I write my RFP, are the priorities that I'm going to emphasize throughout it. And this is a nice, short, and brief way to get feedback from others about your program and whether you're thinking, whether, you know, you've covered the whole ground, and as they see it as either partners on this program with you or key stakeholders or even participants. whether what's on this document rings true for them. And I think the beauty of this is making it concise. It's something you can, email to a partner friend and say, I'm writing this RFP and this is basically the framework of the program, and does that make sense to you? Have I identified it? So that's one nice piece of that. The other nice piece of all three of these documents is to ultimately think about all of these items in terms of reuse. So let's go to the next slide. This is a tremendous amount of work. If we think about writing an RFP and spending, giving some significant time over a month's period to develop this, this is the kinds of writings, kinds of documents that we don't want to think about as a one-time only use. We should really be writing our RFPs to think about how is it, as I set out to write my next RFP, I can really use what I developed here in that. And that's why, really this more comprehensive step into, who are my target populations, what are the changes in my organization, and really giving due time to describing that makes it in the end worthwhile, because we can reuse it. It can help us cut down the time that we spend even on next year's RFP. How much do we have to tweak next year's if we're going to resubmit to this? The PowerPoint slide that's in front of you right now is kind of that framework of, there was a time where we really thought about developing evaluation where we had a single independent variable and we measured a particular dependent variable. And I think this is the common misunderstanding, that really our programs just don't live in a world anymore that is controlled, that we can't control for that dependent variable. We live in a very complex and very rapidly changing environment. And really we need to develop our programs with that insight and ultimately our evaluation. The idea that we move from a needs assessment to process evaluation to outcome evaluation and impact kinds of evaluation are even beyond that complexity today. Within each of those elements, we have to really think about what at the moment and context-wise is driving our program success or creating challenges for it. So to sort of finish up on today, we wanted, although we want to be comprehensive in our writing, we want to make it most relevant. And I hope that the tools that I've provided today are means for you to really tap into the tacit knowledge that you have to better understand and articulate the key points of either the context or the outcomes or the elements beyond the program itself that your organization will have to be savvy to implementing alongside with the program itself in order to make this successful. We want to be concise, particularly around talking about resources. Resources are limited, understanding what resources are available to you within your organization and what resources you're going to have to reach out to others in the community to help provide, or how you work with other organizations. We want to be very succinct about that. And finally, as we're writing our RFP, I think we want to use our words sparingly. Oftentimes as I read RFPs, I see people tend to use a lot of academic and theory kinds of language. And in the end, when people read these, it's really the simple language. What makes sense, and how have we connected the various elements of the RFP into a story that, holds its weight and is compelling. Drop down 2 more. The CDC has this, I laughed, I found this little slide that they have up that goes along with the original diagram I gave you, and it said, why do I need a logic model? And according to the CDC, you really don't ever need a logic model, but you always need a program description. And I can't emphasize this as being more true. The program description ultimately, it identifies the series of choices you've made. And the more knowledgeable we are about how we've made those series of choices, the better we can begin to direct our evaluation processes to reflect those choices and identify the hard work we've really put in to making this all come together and benefit our program participants in the end. I'd like to take this time to open up for questions. I'd also like to thank Courtney Schuler-Smith for having me today. And also, I'd like to, put out there that these webinars are not meant to be sort of one-directional. It's hard because of the technology. They tend to be one-directional. But I think as Adirondack Rural Health Network, as the North Country 5th, and as the North Country District, we really would like these webinars to begin to bring our partners to engage in conversations around the various topics that we're presenting on. So opening the doors for these to be more lengthy conversations about evaluation or data is really our hope in the end. Do we have any questions?
Okay, well, if you don't have any questions, thank you, Anne-Marie, for that wonderful presentation, and thank you, Dylan, for being the webinar facilitator. We wanted to we got a quick question. No?
Just Michelle Law saying thank you.
Oh, well, thank you very much, Michelle. Well, you're welcome. We will be putting this up on the ARHN website by Friday. So if anyone missed it, I had a few people that had mentioned they wanted to see it. So if anyone in your office you want to tell them how great it is, they can go to the ARHN website on Friday and listen to it themselves. Thank you, everyone.